Hi, my name is Marianne and I'm going to do an IV insertion today, and I'm going to wash my hands, and I'm going to do this thoroughly and rigorously for 20 seconds. Okay, and then I'll dry my hands, and then I will collect all my items. I've checked my patient and compared it to the MAR, and it is the right patient. And I'm going to first start with having all my materials. I'm going to open up my IV start kit. I'm going to take the tourniquet. I'm going to take this tourniquet. I'm going to apply it to this patient's arm so that I can palpate and find a vein. So I'm just going to wrap this around. I'm going to pinch, pull, and tighten. Okay, and then make sure it's tight enough. Okay, so then I'm going to, I did that 2 inches above the elbow. So now I'm going to palpate for a vein. And okay, I found a vein that I want to use, and I do that by visualizing it and palpating it. I'm going to take the tourniquet off. I come back to my IV start kit. I'm going to get my chlorhexidine, and I'm going to, wait, just kidding. I'm going to put my gloves on first. Okay. All right. Now I'm going to grab this chlorhexidine. I'm going to break it, and I'm going to rub the site rigorously for about 30 seconds, and then I'm going to put that to the side. And while this is drying, I'm going to go back to my IV setup area, and I'm going to prime my J-loop. So I'm going to open this. I'm going to grab my J-loop. I'm going to take my saline, take this cap off, and I'm going to connect this saline to this purple end while also making sure that the clear end stays sterile. So this is my sterile field. I'm going to once that's attached, I'm going to come down to this end, and I'm going to make sure that it's patent, okay? And so it is flushing. So I want to make sure that I put that there. Make sure that stays in there. Okay. Okay. Now I'm going to grab my needle and move that out of the way. Okay. So I'm going to come back to my patient. It is now dry. I'm ready to go. My J-loop is primed. So I'm going to come back, put this tourniquet back on the patient. Okay. Make sure that's tight. And so now that area is clean, I want to make sure I don't touch it again. But I'm going to make sure that I'm in the right spot. I'm going to get my needle. I'm going to take this, grab the needle, and then I'm going to make sure that the catheter is all the way down to the hub, and make sure that the bevel is up when I'm inserting it. I'm going to go up to my vein, and I'm going to visualize it, and then I'm going to insert it bevel up at a 15 to 20 degree angle. You're good. Okay, and I'm going to make sure that's good. Okay, so I'm going to pull it tight, and I'm going to make sure that that's taut so that the needle can get in there, and then I'm just going to insert the needle until I see flash. Once I see flash, I'm going to advance it 2 millimeters more. And then once I've done that, okay, I'm going to push the catheter in. And then before I pull the needle out, I'm going to come over here and take this tourniquet off. Make sure that it's in there. And then I'm going to take this needle out, and I'm immediately going to attach this J-loop, and it's going to bleed at the same time. So I want to make sure that I hold this securely so that the catheter is not pulling out of the skin. I want to hold this tight, and while that's going, I'm going to take this gauze here and I'm going to clean up the blood because there will be blood kind of in this area. You can also use my little chlorhexidine thing. I go here. Okay, so now that it's clean, it's in that spot, I'm going to go back over here and grab my Tegaderm. Oh, I'm gonna flush it first. Okay, so it's not clamped. Okay, so it is flushing. The patient did not have any reaction or any discomfort, so I know that it's not infiltrated. So I wanna, after that's done, I'm going to clamp this and make sure that I keep that clamped. And then I'm gonna come back over here and I'm gonna grab this Tegaderm. I'm gonna grab it and I'm going to pull this off of it. So I've had that off. I'm going to take this and I'm going to make sure the window is going to be over my catheter part because I want to make sure that it's going to show it in the window. So I'm going to put that over the top like this. And I'm going to make sure that it's in the little window and it's covering that. Okay, so I'm going to put this and make sure it's right there. And then I'm going to take this little thing off of it so that that is securely attached. And then this has a little piece of tape here so that I can secure this J-loop to the arm. So I'm going to lay it flat and make sure it's arching away or towards back towards making a little J area. Then I have this little cover. I'm going to tape this to the arm, and then at this point it's clamped and everything, so I can take the saline off and have that be there. And then at the end I'm going to take this little piece of tape that's still on here. I'm going to label it with my initials and the date. And that will be attached to the IV so that the next person can see there. Okay, so it's gonna be like that, and now it's complete. So after I clean it up,